Hi, welcome to Delegation. This is going to be one of the more important skills that you learn how to do, not only to pass the NCLEX, but also in practice, because there's a lot of components to it and you're asked to do it very frequently. So what we're going to do in this lecture is to talk about delegation, the 5 rights of delegation, and strategies that you can use to delegate effectively to the unlicensed assistive personnel. So why do we need to delegate? Well, originally it began in the 1980s as a response to a nursing shortage. So there weren't enough skilled nurses to care for the patients, and so they developed this role that used to be just called nursing assistant, but now it's called unlicensed assistive personnel. So as a result of those unlicensed nursing personnel being used during this time of shortage, facilities realized that these people, who sometimes they refer to as nurse extenders, would actually help the organization financially because they worked cheaper than registered nurses. Also, at the time, the role of nursing was changing, so that nurses moved from direct patient care needs for every patient care need to more of managing patient care. So we refer to unlicensed assistive personnel as UAPs, but you also hear them called nursing assistants. We also see nurses delegate to licensed practical nurses who do have licenses, but who don't hold the same amount of authority and accountability for patient outcomes. The problem is, with UAPs in particular, there's no universal hiring, training, or job description. So this makes the task of delegation much more difficult. So one of the key concepts that a nurse needs to understand is supervision. And supervision isn't just watching someone, but it's providing guidance and oversight to make sure that the task that's being done by the UAP is done correctly. It's an active process. You don't just supervise at the very end of the shift. It's continual, and that's something that we need to think about when you delegate tasks to UAPs. So if you look here, the definition of delegation is the transfer of responsibility for performance of an activity to another individual while you retain the accountability for the outcome. And that's an important thing for you to remember, because nurses are the ultimate accountable person when they're caring for patients. So to complicate matters even more, each state has its own nursing regulations, and each state Practice Act defines which level of licensed nurse is authorized to delegate. The Massachusetts Board of Registration and Nursing's website has the regulations on there. They're written in a lot of legalese, and hopefully through this lecture we'll be able to boil that down into something that you'll be able to actually remember and apply to your practice. So the delegation has legal ramifications for you, and one of them is that you have worked long and hard to get this nursing license, and you do not want anything to jeopardize that nursing license. And one of the things that could possibly jeopardize your license is if you delegate inappropriately. So nurses who delegate inappropriately are negligent and can be found negligent by the Board of Registration in Nursing, and they can also be sued for negligence. Now, the standard that's used is what we call the reasonably prudent nurse. So in other words, this would be, what would the nurse with a similar background and education do under these circumstances? So let's take a really ridiculous example. Let's say that you had the UAP push IV Lasix on your patient. Now, there isn't a reasonably prudent nurse out there who would do that. So in that case, the nurse who actually allowed the UAP to do that would be found negligent. There's other things that go along with whether or not somebody can be found negligent or be sued, and that's in another lecture, but we won't go into that right now. So when you delegate, one of the things that we look for, what we call the 5 rights of delegation: right task, right circumstance, right person, right direction or communication, right supervision or evaluation. So the right task, you know that the task is right when it occurs during routine care. It is something that would frequently occur in the daily care of a patient or group of patients. The results from this task are predictable and the potential risk is minimal. The task uses a standard care and an unchanging procedure from patient to patient, and it can be performed according to an established sequence of steps. It also cannot require any application of the nursing process, which we'll get to in a little bit. So the circumstances, sometimes you also hear this referred to as the right patient, okay? So the circumstances for delegation are right if the patient is stable. Now, all of this delegation is based on the fact that you have assessed your patient. You cannot delegate things to people without actually knowing what the patient is like. And you see this done all the time when people make patient care assignments without reviewing what the patient's condition is. Again, the outcome needs to be predictable. The decision to delegate was done after analysis of the patient's needs. Ongoing assessment or decision making is not needed. Now remember, the UAP is assisting you, not replacing you. Anytime a patient's condition changes, the nurse needs to reassess the situation, and if needed, they need to rescind the delegation and say, you know what, this isn't going to work. We're going to need to change up the assignment. And you see that nurses oftentimes are very reluctant to do that because people, when they work, they don't tend to like a lot of surprises like that. And so sometimes you see nurses feel a lot of pressure to keep things the way they are in order to make sure that everyone is happy. Well, the goal, unfortunately, is not to make sure everyone is happy. It's to make sure that the patient is cared for safely. So one of the more difficult rights is to determine if you have the right person or the right UAP for the job. Now, the Nurse Practice Act will tell you if you are able to delegate something. So, for example, you can't delegate something that you as a nurse cannot do. Also, remember how I said there was no universal training for UAPs? This becomes a problem because what you have to do is you have to know the facilities, policies, and procedures as to what UAPs in that institution are allowed to do. This also means you need to know the job description of the UAP that you're working with. And the other thing is, just because somebody's gone through the training doesn't mean they actually know what they're doing. So one of the other considerations is, does the person you're working with have the appropriate knowledge, skills, and abilities to carry out the task? Can you confirm their competency? Have you seen them work before? If you do not know a UAP, you do not know what they're capable of doing or not doing. So that becomes very tricky if people are floated. And sometimes what you'll need to do is you'll need to ask other people what that person is capable of, how much experience they have. You might even have to ask the UAP themselves, how long you've been here, what type of unit are you on, are you comfortable with doing this procedure? And this is something very second nature to us because we've all worked with people who are good and people who are not so good. So the lesson to learn from the right person for the task is to know who the players are before you go around delegating things. The right communication means that the nurse needs to clearly communicate the expectations of what needs to be done. These people are not trained as nurses, and just because they've been around a lot of patient care situations doesn't mean they have a level of knowledge that you have as the nurse. So this means that the tasks need to be explained clearly. You need to explain what the activities are that they need to be performed, what patient-specific instructions you need to give, what needs to be reported back and when, and what the expected results or potential complications could be. So you would say to the UAP, this is what should happen. If it doesn't, please come and get me. And this also sort of dovetails with the next one, which is the right supervision. And that means just because you've told them to come and get you if there's a problem, that doesn't mean you don't have to go seek them out to make sure that things are going smoothly. So the right supervision means that you have to supervise this person and follow up on the tasks. So you need to check the progress, monitor the quality of the performance, and be ready to intervene if you see anything deviating from either what you expect the outcome to be or what you expect the performance to be on the part of the UAP. You also need to obtain feedback from the UAP and provide feedback to them. So you would say to someone, okay, you did a great job with that. Now that we've finished this, what we need to do is we need to try this. Or maybe this didn't work so well, so maybe together we should go in and do this other thing. You also need to evaluate the whole delegation process, see where things worked well and where things may have broken down. And you also need to make sure that documentation is done. Because we've all seen those patient care flow sheets. In some facilities, UAPs can actually document on their own flow sheets. In other institutions, it's the job of the nurse. But the documentation is key, because just because you've delegated the task doesn't mean you're not responsible to make sure that it's been documented. So the National Council of State Boards of Nursing is very worried about delegation. These National Council, they're the people who make up the NCLEX exam. And this website has their delegation model on it if you choose to look at it. But we'll try to get it down into something you can remember. And actually, it pretty much is the 5 rights of delegation. So one of the things you need to realize is that the state regulations in Massachusetts are very liberal. Other states are very specific. So if you were to read some of the regulations in another state, you would see a list of things that licensed practical nurses cannot do. That is not the case in Massachusetts. When you are dealing with UAPs, UAPs can never assess. Okay, they can never assess, they can never evaluate, they can never teach. So the minute you see an NCLEX question that has teach, delegate, assess, okay, they don't do any of those. You need to know the training of the UAP you're working with. You need to know or anticipate what the patient is at risk for. And you need to be able to explain to the UAP what clinical clues the patient will be giving them that they need to report to you. So you may need to say to the UAP, if the patient's respiratory rate is greater than 24 after you ambulate them, come and get me. You cannot say to them, if the patient gets short of breath, come and get me. They may or may not know what short of breath means. Is short of breath 22? Is short of breath 36? So you need to be very specific. So this slide just tells you that you do have legal authority to delegate by your Nurse Practice Act, your employer's job descriptions and statements, and national standards of care. So, okay, so here's where we're going to start to talk about licensed practical nurses, or in other parts of the country they're called licensed vocational nurses. Okay, these nurses are licensed. They take a licensing exam very similar to the NCLEX. It's really difficult, just like the NCLEX. They have between 10 months and 2 years education. They are trained to be able to assess patients. They can look at a wound and measure it. They can say, I think that this treatment is working. But what they don't have is they don't have ultimate authority or accountability for the patient care. So yes, they can assess a patient, but they cannot do the initial nursing assessment. They can contribute to the care plan, but they cannot develop the care plan. They cannot make nursing diagnoses. They cannot approve the plan of care, okay? They can and do have nursing judgment, but they also need to communicate with the registered nurse. They can evaluate if a treatment is effective or not effective, but that information that they have, an opinion, needs to be given to the registered nurse so changes can be made to the plan of care. The UAP, on the other hand, they can do none of this. The UAP may not delegate what has been delegated to them. So there's no like pecking order where the UAP with 3 years experience gets to boss around the UAP with 6 months. That doesn't happen.